Hey guys, welcome back to the channel. Are you confused about whether you should sit the ORE or the LDS? Or just not sure about what the differences are? Then this video is a must watch for you. The ORE and the LDS, both of these exams are required for overseas qualified dentists in order to register with the GDC. Hopefully by the end of this video, you will have a comprehensive picture of everything you need to know about the differences between the ORE and the LDS exam. So let's get cracking. So who's the awarding body for the examinations? The ORE is conducted by the GDC. The LDS, which is the License in Dental Surgery, it is conducted by the Royal College of Surgeons of England. How many parts does it comprise of? Well, both the ORE and the LDS comprise of two parts, so part 1 and part 2. Part 1 is a theory-based exam and part 2 is a practical-based exam. What is the format of each part? Well, both part 1s are computer-based exams and are done remotely online. They are also divided in part A and part B for the part 1 examination. How long are the exams? Part A and part B are 3 hours long, each for the ORE, whereas part A and B both are done in the same sitting and are also 6 hours long. What does part 1 include? Well, the ORE part A test includes a 3 hours exam which covers clinically applied dental sciences and clinically applied human disease, whereas a part B test, which is also a 3-hour exam, covers more of law and ethics, health and safety of dental practice in the UK, whereas the LDS part A is also clinically applied science and clinically applied human disease, and also part B is aspects of clinical dentistry, law and ethics, and health and safety. So what is the format of part 2? Well, ORE is held over 4 days and each part is done per day. So you have 1 day for the dental mannequin operative test. The second day is the objective structured clinical examination, or the OSCE. The third day is a diagnostic treatment planning exercise, the DTP. And the fourth and the final day is a practical examination, medical emergencies. The LDS part 2 is also held over 3 days and each part is done per day. For the LDS part 2, you have the OSCE based exam, you have the dental mannequin operative test, and then you have an unseen cases, objective structured long examination, OSLE model. How often are these exams held? Well, the ORE part 1 exam are held 2 times a year, twice a year, generally in April and August, whereas ORE part 2 exams are held 3 times a year, generally in January, April and September. The LDS part 1 is only usually held once a year, usually in April, whereas LDS part 2 is held twice a year, usually in April and August. How many candidates do each of the exams cater for? The ORE part 1 caters for 200 candidates, the ORE part 2 caters for 144 candidates. The LDS part 1, on the other hand, caters for 120 candidates, and the LDS part 2 only caters for 60 candidates. So what is the cost? Well, the current cost for part 1 ORE is £806, and the part 2 cost for ORE is £2,929. There's also an additional fee of £685 for the ORE document processing and assessment. The part 1 LDS, on the other hand, is £850, and part 2 LDS is £2,940. So how do you apply for these exams? For the ORE, you apply for the exam through the GDC website, whereas for the LDS, you apply for this from the Royal College of Surgeons of England website, and both of these links will be in the description below. Well, I hope you found the video useful. If you did, then please kindly like and subscribe to our channel, and we'll be bringing more content for you in the near future. Thank you very much for listening.